Hello, everyone, and thank you so much for joining me this afternoon out here in cold Chicago. I know that you all are over in California, so I'm very excited to be here with all of you. My name is Karina Villa, and I'm a state senator in the 25th Senate District out here in Illinois. So I just want to give a brief discussion of what that means for those of you who don't know this area. It's an actual stronghold, has been historically always represented by a Republican. I'm a Democrat. And so the person that I replaced was a person by the name of Jim Oberweis. He's an ice cream man and has run for many different offices out here, and actually had run a campaign that was extremely racist against Latinos long before Trump ever ran for office. So it was a pretty monumental shift in representation to go from a person who was anti-immigrants to daughter of immigrants. So for those of you who know La Michoacana ice cream, I used to say it's out with Oberweis and in with La Michoacana because my mom is from Michoacan. So that was my little play on words. The area I represent is predominantly Caucasian, not Latino, but I myself live in a small town called West Chicago, and that is predominantly a Latino community. So it's been a very interesting journey. I was a school social worker for 15 years prior to running for office. And it really has been an interesting journey during COVID, because I think that one of the things that we really got to see was that our essential workers were highlighted as being at the same level as emergency room doctors. So the folks that were working frontline, whether it was at the manufacturing companies, whether it was at the grocery stores, whether they were the janitorial staff in the emergency rooms, or our folks in the field making sure that food was being kept on the table, or the folks working, in las carnes, right, in the butcher areas of our economy. Those folks were the ones that were frontline. They were making sure that our world kept on running. And so the part of the just absolute joy that I have received in the last few years during COVID has been that I have been here to represent and fight for health equity for the frontline essential workers. My district is so unique in Illinois because I have over 350 in my district. So what happened when COVID started and essential workers were told you have to keep going to work was that families, neighbors, school teachers were calling to say they were so fearful for their friends that were having to go work at these factories where they were not being taken care of. They were asking what we were doing as a state legislature to protect these workers. So I really was able to dive in and first started meeting with my county health departments and demanding from them to come and make sure that these facilities were following CDC guidelines. The health departments were overwhelmed, but I was relentless in this pursuit. From there, I was contacting the Attorney General's office on an almost daily basis with reports of factory owners not taking care of their employees. I was following closely what was also happening in California and seeing some of the methods that they were using to make sure that rules were being followed. I saw that water was actually shut off when there was these egregious reports of people not being protected in the workplace. That led to monumental legislation in many ways. So one of the pieces of legislation that I was so just thankful to have had a seat at the table to bring the voice of the workers to was legislation in Illinois that we passed saying that the onus was on the employer to prove that they were following CDC guidelines. And if they had not followed these guidelines, that they were then liable for their employees who got sick and eventually died from COVID. We passed that piece of legislation on the House floor with almost a unanimous vote. I'll never forget the day that I stood to speak about that legislation. All of us, my colleagues and I were on the House floor. It was when I was a House member. Sorry, I was a state representative and then became a state senator. So I was on the House floor that day. Everyone had masks on, and I remember taking my mask off and putting on the beard net that had been given to the employees of a factory in my district. And they were told that that was enough to protect them. A beard net is what I put on my face when I stood up to speak. And I looked around at all of my colleagues and I said to them that this vote was going to be a vote that people would remember them by for the rest of their careers and of their lives. In that moment, people thought there was no way we were going to have almost unanimous support on this vote. And guess what? We got almost a unanimous yes vote on this piece of legislation. Carrying that momentum, I'm kind of like glossing over so much that happened because of our time constraint. But first, having someone in office that understands the Latino community, that understands the needs of the manufacturing workers that come to work in this district was so critical and so essential. So if you out there are thinking, why would I run for office or what kind of difference would it make? This is an example right here, okay, as to why we need people to run for office. Second, when we were going through this time of COVID, I'm telling you that I represent an area that is predominantly Caucasian, predominantly middle to upper class. The community that I represent that is Latino majority has been underrepresented forever, my whole life and before, right? The voices of those workers were what drove me to work hard on this legislation. But for years before, I had a Latino caucus, the Illinois Legislative Latino Caucus, who had been fighting day in and day out to bring changes to the state of Illinois when it came to representation in healthcare for our families. We were relentless in the struggle before I was ever elected. That struggle has been there forever. I am so proud to say to all of you that because of COVID, because of the essential workers, because we have representation in the Latino caucus our numbers are stronger now than ever. We were able to have historic legislation in the state of Illinois that are abuelitos and abuelitas who have worked in this country, who have lived in this country, who have raised children in this country, who are undocumented, 55 and older, will be eligible for our state Medicare, state Medicaid healthcare. And that is one of the biggest and most amazing accomplishments in the United States for undocumented individuals. We know that our abuelitos and abuelitas have gone to work, that our moms and dads have gone to work, and at the end of the day, they've paid their taxes, and if they're undocumented, they have little to show for it. This is, we are saying we see you, and we're not stopping there. We are going to continue to work on passing legislation when it comes to healthcare. I am introducing a piece of legislation that says if an adult has severe and profound disabilities, that they would qualify for healthcare as well. We're going to keep fighting until everyone in Illinois is eligible, regardless of their status, for healthcare, because we know that this is so imperative. I am so proud to say that Illinois is one of the safest and most welcoming states in the United States for undocumented families to live in. I want to make sure that I reference in the chat, I am not sure if you are able to see it, a link that we are posting. This is the SDHES document that the Illinois Legislative Latino Caucus put together at the beginning of COVID. We put together our priorities. We delivered it to the governor. We said, these are our priorities. This is our unapologetic momentum of what we are fighting for Latinos in the state of Illinois. We passed so many pieces of legislation, from education to health equity to job safety. And I know, and I'm just so excited to keep moving forward, because I know that we still have so much more to go. I don't know if we can do a time check, if we are ready for questions. I want to make sure that I'm cognizant of everyone's time. I see a bunch of chats now here on the side. I hadn't seen them earlier.
Yeah, and this is Maribel, one of the organizers here. So we have questions and answers. Maybe I can show one of them on screen. So I'm going to show it on stage. You argued in the Senate Education Committee that all high schools in Illinois would be required to offer instruction in how to understand and evaluate news and social media as part of their computer literacy courses under a bill out of, I think this was a longer question, maybe didn't quite make it, but
yeah, he's talking. So Daniel, thank you for that question. This is in regards to the media literacy bill. Leader Lisa Hernandez carried the bill in the House, and actually my chief of staff, Kate Peterson, who is watching right now, her professor actually brought this piece of legislation to us. This was making sure that students are taught media literacy, so that media is coming at students in so many different forms, in forms that, quite frankly, I know that are far beyond what I even know exists, right? My teenage nieces and nephews are constantly showing me all of the new ways in which they are receiving information on a regular basis. We want to make sure here in the state of Illinois that our children are able to decipher what is real, what is not, what is fact, what is proven, what is science, even in those quick 30-second interactions that they're receiving online, and that they're able to explain what is the difference between real information that is fact, scientifically proven, versus someone's opinion.
Thank you. And we do have another question. I'm going to show it on stage.
Thank you, Daniel. In terms of the support to the local communities, first and foremost, I do want to send a huge shout out to our Latino state legislative brothers and sisters in California, because I know that they have been in the struggle, they've been in the fight. I have always loved to look over to California and see what are the things that California is doing that we can learn from and we can emulate. So I think that one of the biggest things that really happened was that there was this community groundswell movement. There was a group that was formed called Illinois Unidos. This group kind of popped up and started very small at the very beginning of COVID. And it was mostly community members, mostly community leaders who had worked across the state of Illinois with the Latino community, wanting to come together, bring information to each other, and network and try to get resources and information to each other. That group really was strong in terms of the information they brought to the table, the unity, the strength, which then let us as legislators say, look at this coalition. They are experts in the field. This is what they are seeing. They are working day in and day out with la gente who needs it the most. And this is why we need this legislation to pass. So that beautiful coalition of people that came together out of a tragedy were really able to uplift us as legislators to have the voice that we had. It was one of those things that it was like this perfect moment. And I hate to say perfect because there was so much death and tragedy that happened during COVID. But through all of that negativity came this legislation to have healthcare. Really, we had thought we were going to pass healthcare parity where, people who have private insurance, they're able to keep their children on until I believe 26 years old. So we thought that we were going to be able to get that parity for Medicaid before we would ever think about having los abuelos and parents covered, right? We never thought that we were going to start this way, but because of COVID, that's what kind of gave us the momentum to get there. Sorry, I'm trying to read through the notes as well. I see someone here from the Director of HIV Prevention Services, one of the great pieces of legislation that brought tears to my eyes and was really so critical and so delayed was the decriminalizing of HIV transmission. That was a really big deal and something that I was very proud to vote on. So thank you, Thelma, for the work that you do for the community. Are there any other questions other legislators in other states can shepherd it in their communities? So it's interesting. So because the first race that I ran was also a Republican stronghold, and I flipped that seat for state representative, and then I ran 2 years later for Senate and flipped that seat. I have always just been like, work, campaign, like stateside campaign, and like had never really gone out to any of the conferences, even though my colleagues were all like, Karina, you have to come to this conference or that conference. I was always like, no, because if I'm not in session, I need to be knocking on doors to make sure to win the next election, because it's such a strong Republican stronghold. Now, with the redistricting, the Senate district that I'll actually be running for is the only new additional win. It's a baby Latino majority district. So within the next 10 years, this district will become a Latino majority. So, oh my gosh, can you believe it? I sure can't. If I win this next election cycle, it just is such a historic, it's such a historic win for the people out in the suburbs of Chicago, because we have a lot of Latinos moving to the suburbs. So in any case, I plan on getting more involved with going to some of these conferences is my answer, and hopefully in the future being able to network face-to-face with some of the folks from some of these organizations.
Thank you so much, Senator. Is there anything else that you want to let people in our audience know today?
So I think that one of the things that's really critical, as I said earlier, that I was a school social worker for 15 years prior to running for office, there is a mental health crisis across the country. We are having just such every level on the continuum of care when it comes to mental health services, every level is saturated. We are, before COVID, we were working in a reactive mode. Now we are working in crisis mode. And we all know that when there is a crisis mode, it's not the best way to be working. So in Illinois, we really are starting to focus on how can we incentivize people to go into the social work field? How can we make sure that we are providing as many resources to schools as possible for them to be able to then in turn hire school social workers? My personal opinion, we need school social workers, not school police officers. That's my, of course, soapbox that I'm sure you would understand why. But to me, it's the mental health aspect. And it's not just children's mental health. It is adults who in the past have never maybe needed mental health services, who are now stressed beyond capacity and are really struggling. So I really would encourage all of us to really think about some of these ways to modernize mental health, to bring it to the forefront, to normalize it. And one of those things is through telehealth, right? One of those ways is through telehealth. As a social worker, you always have to practice what you preach. So during COVID, I was meeting with my therapist through Zoom. It's not my preferred method, but it works. And there are a lot of people who do benefit from this way of connecting, especially people who have phobias or people who are have severe anxiety or social anxiety, connecting on social, not social media, sorry, through a protected Zoom link or whatnot is really beneficial. So finding ways to expand these types of services, I think, is only going to be beneficial for future generations.
Absolutely. And on that note, we will close the session. So well said. I agree with Adriana here in the comments. Thank you so much for joining us today. The session is recorded, as everyone can see, and we will be posting this after the event closes later today or this weekend. So thank you so much all for joining, and we will see you in the next session.
Muchísimas gracias a todos. Take care. We'll see you soon.